like to talk about exercise and chronic kidney disease. I have no specific relevant conflicts of interest. And the objectives today are to go over definitions of units of exercise and be able to make recommendations for the general public and exercise recommendations specifically for chronic kidney disease. I'd like to be able to talk about prevention of chronic kidney disease with exercise and cite examples of patients with chronic kidney disease who have participated in intense exercise. So let's start with a case, question one. A 66-year-old male with chronic kidney disease 3, secondary to biopsy-proven diabetic nephropathy, asked for recommendations of the minimum amount of exercise that would benefit him. No severe joint disease, but the patient's been sedentary with minimal exercise for 20 years and has moderate obesity. So the initial exercise goal will greatly depend on the individual, but which statement is most accurate about an initial exercise goal? One, doing anything, even a minimal increase in walking for a few minutes a day is better than nothing and known to be beneficial. And even if you get minimal exercise every once in a while, just standing up from a sitting position is beneficial. Two, there's a threshold, and the lowest threshold for deriving benefit is starting at least twice a week with a total exercise duration of 10 minutes, even if the 10 minutes is split up into several sessions. Or three, at least 10 minutes of continuous activity, even if the activity is very light, leads to a significant increased benefit compared to shorter sessions. So start with 10 minutes multiple times a week. That's the recommendation to derive some measurable benefit. So let's take a poll. Daniel, if you would enter that poll.
Yeah, and I just had it and now I'm not seeing the same questions. Give me 1 second. Let me see if this, no, that is not it.
It just show up. It shows up for me.
But yeah, these are incorrect. These aren't his questions.
Oh, I
My
see.
gosh. I'm sorry, Steve. I don't know what happened to those. Let me see and try one other thing. Sorry.
Okay, well, perhaps we should just put them in the chat, put the responses if you can.
Yeah, I think we can do that. I'm so sorry about that, Steve. I don't know what happened to these, but yes, maybe we can record our answers in the chat.
Okay, so we'll take a few minutes to record the answers in the chat. Okay. And we've got a lot of votes for one. We've got a vote for three. Okay, so let's go on. And for that 66-year-old male, in addition to strength and balance training, what would be an eventual goal for weekly moderate exercise? 60, 90, 120, 150, or 200 minutes per week? We'll go another 20 seconds. And it looks like most people would guess 150 minutes per week. So let's go on. A metabolic equivalent. One met is the energy burned at rest, and the average adult in the US weighs 165 to 190 pounds, burning 60 to 76 calories per hour. And there's a few categories. Light, less than 3 METs, is walking slowly or light household chores or fishing. Moderate, 3 to 6 METs, walking briskly. Moderate household chores or light exercise. And vigorous is greater than 6 METs, and that's jogging and hiking, more challenging chores, or more vigorous sports. And for example, some specific numbers: sitting and reading is 1.3 METs, strolling or walking slowly is 2 METs, walking at 3 miles an hour puts you into the moderate category, and running 5 miles an hour would be vigorous, or 8.3 METs. And so let's go over the exercise recommendations for the general public. In 2018, there was a physical activity guideline advisory committee, And in June 2016, 17 medical experts were appointed by the Secretary of U.S. Department of Health and Human Services to make an update to a 2008 report. And the 2008 report specifically recommended for 18 to 64-year-olds 500 to 1,000 minutes of moderate to vigorous physical activity, or 150 to 300 minutes per week of moderate intensity physical activity. And that should be modified for older adults as needed. And the 2018 committee concurred with this target range. They also talked about muscle strengthening, targeting all major muscle groups, 2 to 3 non-consecutive days per week, 8 to 12 repetitions to fatigue, and one set was effective in increasing strength, and limited evidence that 2 to 3 sets was more effective. And then also balance training should be combined with strengthening for older adults. And you'll see these similar recommendations in publications from, for example, the American College of Sports Medicine and the CDC, basically 150 minutes of moderate intensity activity per week, 2 times per week of strengthening activities, balance activity for those 65 or older, but also a comment that for all ages, just sit less, move more, and all physical activity counts. And the data for which those recommendations arise from is shown in this top curve. You see that there's a very steep improvement in the relative risk of all-cause mortality, going from inactive, or 0 minutes per week, to 150 to 300 minutes of moderate activity per week, a significant improvement in all-cause mortality. And if we look in more detail at the bars, we see that most patients in the United States have less than 10 minutes per week of moderate intensity activity, 31%. 19% tend to less than 150. So more than half of the population is either inactive or insufficiently active. And then we start to get with 16% in that target range and a fraction at larger time devoted to moderate intensity activity. The one thing to note, and I'd like to concentrate on this left column, is so many things have been shown to improve and benefit from activity, physical activity, cardiometabolic conditions, cancer, brain health, weight status, improvement in falls and physical function in older adults, breast cancer, colorectal cancer, prostate cancer, arthritis, hypertension, diabetes, multiple sclerosis, dementia, other conditions with impaired executive function, and for pregnant patients, reduced risk of excessive weight gain, reduced risk of gestational diabetes, and during postpartum, reduced risk of depression. And the thing to notice about this big list, which was in the 2018 report, is chronic kidney disease is not in a list of diseases which benefit. And why is that with this comprehensive report? Well, the reason is, this is a table in that report. They looked at the top 10, and what they did is they looked both at the prevalence and the number of search results when they looked up studies, and they ranked them by summing the prevalence rank and the search rank. And you see the sum in this column, and then they ranked them. And the top 10 were included in the report, and there was a tie for 10. So chronic kidney disease was number 12, just behind those which were ranked in the report. So chronic kidney disease was not specifically studied in this report and reported on in terms of benefit. Now, one thing is, this is the National Kidney Foundation Fast Fact list with the recent update. And we've seen this many times before in presentations. 35.5 million US adults are estimated to have kidney disease, 1 in 7 or 14%. 9 in 10 adults with kidney disease, 90% don't know they have it. 1 in 3 adults with severe kidney disease, GFR less than 29, don't know they have it. And 1 in 3 adults in the US, a third are at risk for kidney disease based on having diabetes, hypertension, and or obesity. So it's likely that a lot of patients with chronic kidney disease were included in these studies, which were in the 2018 report, because a lot of those studies didn't check specifically for chronic kidney disease because it's so prevalent. One interesting set of data that was in the report was just sitting. And notice this top line, less than or equal to 2.5 med hours per week. Very inactive patients that just more sitting during the day significantly increased the hazard ratio for all-cause mortality. So sitting less can improve your mortality, even if you're very inactive. What about the length or intensity of individual exercise sessions? And I know we had at least one vote for this. And if you looked at the 2008 report, and the person who gave that answer may have been familiar with a previous recommendation that in 2008, they recommend that for moderate to vigorous physical activity, the bout should be at least 10 minutes because there was insufficient evidence for the value of exercise less than 10 minutes at a time. But the 2018 committee was able to conclude that bouts of any length contribute to health benefits, and there's no specific threshold. You no longer need that 10-minute minimum. And just replacing sedentary activity with light intensity physical activity does reduce all-cause mortality, cardiovascular disease incidence and mortality, and the incidence of type 2 diabetes. Now let's go over the specific recommendations for chronic kidney disease. Back in 1995, there was a prescribing guide for exercise for the dialysis patients, and the list of experts included someone who some of you may have known, Christopher Blagg from Northwest Kidney Centers, among a number of other experts across the country. And that prescribing guide said most studies have reported on sessions of 30 minutes duration, 3 to 4 days a week for benefits. So some of you, if you were thinking that 90 minutes is the appropriate time, some of previous recommendations were closer to 90 minutes. For dialysis patients, begin with getting up to do something at whatever level that they're able to do, even 5 minutes. And interestingly, the prescription of exercise intensity by heart rate does not work in dialysis patients. And this is still referenced because abnormal exercise there will be abnormal exercise heart rate responses in the dialysis patients, and medications may be prescribed that affect heart rate, and the fluid status can affect the heart rate response to exercise. So instead of guiding by heart rate, learn to watch for symptoms and signs of excess and exertion. Now, there is data that shows that physical activity and mortality are related in chronic kidney disease. And this was an observational study of 15,000 adults, and 5.9% of them had chronic kidney disease. And they classified patients as inactive if during a survey they had absolutely no leisure physical activity. They were categorized as meeting recommended exercise if they had 3 to 6 METs at 5 times per week or greater than 6 METs 3 times a week. The time wasn't specified in the report. And insufficient was leisure activity that was less than recommended, but not inactive. And as you can see, for patients with normal GFR, both insufficient and recommended exercise regimens significantly reduce mortality, but also in those patients with chronic kidney disease, GFR less than 60, a significant improvement in mortality for some amount of exercise other than being inactive. And the most recent KDIGO guidelines, recently published, 2024, the recommendation is we recommend that people with chronic kidney disease be advised to undertake moderate intensity physical activity for a cumulative duration of at least 150 minutes per week or to a level compatible with their cardiovascular and physical tolerance. And that's at a level 1D, meaning 1, most patients should receive the recommendation, but D, the quality of evidence is very low. And the text of the KDIGO guidelines say, we don't really have hard data for this recommendation for chronic kidney disease, but there's no reason not to recommend the same as is recommended for the general population. Now, the 2012 KDIGO guidelines were a little different. They mention at least 30 minutes 5 times a week and did not mention moderate intensity. And similar recommendations occur in other countries. The UK Kidney Research Consortium, published in 2022, they recommended physical activity if no contraindications. And they also say some daily physical activity, some is better than none. They recommended activities aimed at improving muscle strength, balance, and flexibility, and also cite 150 minutes of moderate aerobic activity, or if it's vigorous, 75 minutes of vigorous aerobic activity per week. They also mentioned the point about standing. Break up prolonged periods of being sedentary with light activity when physically able, at least with standing. From that data that showed that just standing can help if patients are sedentary. And the UK guidelines had the very same goals, time goals for dialysis and post-transplant patients. Now, if you try to look up the exercise recommendations, you don't always find the same recommendations depending on where you look. For example, if you look up today, the National Kidney Foundation Staying Fit with Kidney Disease on their site, they specifically say work towards 30 minutes a session. And they state that 3 days a week is the minimum requirement to achieve the benefits of your exercise. So their guidance is really not consistent with the 2018 report about benefit from any level, and it's also not consistent with the KDIGO guidelines. And in fact, a recent scoping review of exercise recommendations for people receiving dialysis states that the heterogeneity and discrepancies between published guidance poses challenges for health professionals who wish to provide specific advice. But we do have KDIGO guidelines, which a lot of us are likely to reference. Can we tell patients that they can prevent chronic kidney disease with exercise? Well, there was a meta-analysis published in the Journal of the American Society of Nephrology in 2021, which cited several studies and did come up with a statistically significant improvement, a decreased risk of chronic kidney disease with exercise. Let's go over just one of those studies, for example, which got almost 14% weight in their study. For example, in the publication on predictors of new onset decline in kidney function in a general Middle European population, there was reduced odds of incident chronic kidney disease from increased physical activity. And they looked at 17,000 healthy volunteers aged 20 to 89. They did a baseline exam and mean follow-up with 2 exams over 7 years. And they looked at the risk of developing a GFR less than 60. And they defined sports activity as endurance exercise exceeding 15 minutes per training unit and or resistance exercise with a certain protocol greater than or equal to 2 times a week. And the patients initially were either free of kidney disease or had chronic kidney disease stage 1 or 2. So their GFRs were all greater than 60. And over the course of the study, 1.5% developed chronic kidney disease stage 3, 8 patients, 0.05% developed chronic kidney disease stage 4, and 12 or 0.07% developed chronic kidney disease stage 5. And so if patients had no sports activity reported, they did have an increased odds ratio of 1.57 for developing a GFR less than 60. So this is just one of the examples of the data used. There was a recent publication on association between a questionnaire-based and accelerometer-based physical activity and the incidence of chronic kidney disease using data from the United Kingdom Biobank. And in that data, let's look at the accelerometer-based data. They have 89,000 patients, and they did a full week of accelerometer data with 7.9 years of follow-up. And of those participants, 2.57% developed chronic kidney disease. And what they found is a very steep improvement, reduced hazard ratio for development of chronic kidney disease, depending on the exercise. And you see it's steep in the range of the current recommendation of 150 to 300 minutes per week of moderate exercise. And it's continues to be steep even above that level 300. So it's from this data suggests that more really is better to prevent chronic kidney disease. And interestingly, for vigorous physical activity, even only 30 minutes a week was very significant in reducing the risk of chronic kidney disease for this study. Now, one effort that we've had at the VA is to try to get patients who are seen in the renal clinic connected with the whole health program. And the whole health program is a program at the VA where we ask patients, what's important to you? What matters to you? What are your goals in life? Many of them want to be more active, spend more time with family and be able to do things and go out. And a large part of achieving their goals is to get them connected with some sort of exercise program. And one excellent program is the GeroFit program. This is a program where patients are given a very personal exercise program of aerobic exercise and strength and balance training, which is supervised by a professional. There are 31 VA systems across the country who have a GeroFit program. And this program applies to patients who are 65 years or older. And one way to find out how patients are doing with exercise is to talk with them And here's a couple of testimonials. One of the patients who we sent and hooked them up with the GeroFit program, a 79-year-old male, diabetes mellitus type 2, chronic kidney disease stage 3B with a GFR of 31. He's in a wheelchair. He weighs 350 pounds, and he lights up when he talks about GeroFit. I love it. I feel more mobile with this program. Here's a 75-year-old male with diabetes, GFR of 28, and gout. And he really enjoys the program. And he says his balance is better, and he has better well-being. So, so many times we prescribe medicines that doesn't make patients feel better. And sometimes they have to tolerate side effects, and we prescribe them and the patients take them because there's a statistical improvement in some outcome. But exercise, we know from just talking to these patients, irrespective of the data, they love it. They feel better. It really affects their life in a positive way. I'd like to go over a couple of examples of patients with chronic kidney disease who participate in intense exercise. And one of the activities which I've been involved in over the years is, for 20 years, I've ridden on the bicycle ride across Georgia. And most of those years, the organizers of the ride fielded a medical team to help the sometimes over 2,000 riders. And I was on that medical team during those years that they had it. And during the course of the activity, I met many patients who had surprising conditions, and they were still able to do that ride. Patients with severe cardiomyopathy, cancer survivors, type 1 diabetics, and there were lots of patients in their 80s doing this ride. And they were an inspiration to other riders, and they were an inspiration to others with similar conditions who are wondering, can they be active? Would they be able to complete a week-long 400-mile-plus ride? This also applies to patients with chronic kidney disease who inspire others. And over the years, when I've had patients, especially young or active, and they're faced with starting dialysis, they wonder, will I be able to be active when I start dialysis? Can I exercise? I was a runner. Can I continue to run? And they've been very encouraged to hear that, yes, it may be tough. You may be very tired after dialysis, but you can be active. And in fact, there are dialysis patients who run marathons. Here's an example. Nate Boucher, a 27-year-old, ran a marathon while undergoing dialysis 3 times a week. So he started dialysis at age 22. He felt terrible for 6 months, dropped out of college. He then gained strength, went back to school, stopped smoking and drinking, and still felt completely sapped of energy on dialysis days. But on non-dialysis days, he started weightlifting, martial arts, hiking, became a certified yoga instructor. Then in 2018, 4 years after starting dialysis, he trained and completed a 5K run. He continued to do increased distance, taught yoga 3 times a week. Then later in the year, he did a half marathon at a pretty good time, 2.5 hours. In 2019, increased his distance and completed a 26.2 mile Detroit marathon with fundraising for kidney disease. And he'd like everyone to know, just because I have this disease doesn't mean I can't run a marathon. A particularly inspiring patient has been Chad Ireland, an Ironman. The Ironman is the 2.5-mile swim, the 112-mile bike, and the 26.2-mile run. And he was inspired by watching the Ironman competition in Hawaii when he was 21 in 1993. And he told his mom, that's going to be me one day. And at that time, it seemed impossible. He was weak. His weight was 75 pounds. And this was after he had been on dialysis for quite a while. At age 10, he was diagnosed with kidney disease, started dialysis at age 11. He had a renal transplant at age 18. But then at age 21, the transplant failed. A second transplant failed, and he was back on dialysis. And then after thinking about it and doing some training, he finally announced at age 31, I'm going to do this Ironman triathlon. And he did it. He completed it at the age of 32. And by age 40, had completed 20 triathlons and rode his bike across the United States in 2009, 4,700 miles in 3 months. So he was the first dialysis patient to complete the Ironman. And he wants others to know, I'm not going to let dialysis ruin my life or run my life. And he does home dialysis. So he has the flexibility and freedom to adjust his dialysis schedule around his life. So when we go back to case question 1, most of you were familiar with the recommendations that for this 66-year-old male with chronic kidney disease stage 3, secondary biopsy proven diabetic nephropathy, with recommendations of what's the minimum amount of initial exercise that would benefit him with no severe joint disease, but he was sedentary with minimal exercise. The answer is there is data to show that doing anything, even a minimal amount of exercise, is beneficial. And you saw from the data, even standing, if you're sedentary from a sitting position, can be beneficial. And it's not true that the lowest threshold is a total exercise duration of 10 minutes, and you don't need 10 minutes of continuous activity. Although if you had been around in 2008 and saw the guidelines from that work group, you would have probably recommended at least do 10 minutes continuously to get a statistical benefit. And most of you knew that the specific recommendation is 150 minutes per week, but you might see other references that allude to a little different amount, like 30 minutes 3 times a week or 90 minutes. But the latest KDIGO recommendations for chronic kidney disease is 150 minutes per week. So to summarize, exercise benefits overall health with lower all-cause mortality. Many systems and conditions have been identified that benefit from exercise, including cardiovascular, brain health, cancers, diabetes, chronic kidney disease, and more. There is a reduced risk of chronic kidney disease with exercise, and the stated goal is 150 minutes per week of moderate intensity aerobics, plus 2 times per week of strength training, and this includes balance training for older adults. If the patients can't achieve the goal, any amount of exercise is beneficial. You don't need a minimum of 10 minutes. And there are examples of patients with chronic kidney disease, including on dialysis, who are really great athletes and can inspire our patients. So, any questions? And I agree, Bilal, sometimes badminton can be very strenuous.
Hey, Yuharn, you have your hand raised. Go ahead.
Yeah. Steve, that was a wonderful talk, and I feel like I need to ask this question standing up. But I think one of the things that, in transplant, definitely exercise is a huge thing because we have a weight limit. And so, we're always trying to figure out how to get patients to exercise. And also post-transplant weight gain is a major issue. So trying to figure out how to have patients incorporate exercise into our treatment regimen is important. I think one of the biggest struggles that we've always had is a lot of the patients come from different areas, and trying to implement an exercise regimen without the patients coming to us is, I think, one of the a major challenge that we've had. How has the VA done this? I assume veterans come from all over as well.
Yes, they do come from all over, and by the way, I should state that there are transplant patients who have done Ironmans.
Yeah, absolutely.
You probably know that. But the VA has done this by including virtual training when needed, because the GeroFit program is both in person, but it's also virtual. And there are a number of programs, including Tai Chi, which are also done virtually. And that's just how they've done it, is the patients don't have to be there in person, and they have someone supervising the exercise programs. And there is a little bit of a need for equipment for certain exercise, but for a lot of exercise regimens, you don't need a lot of fancy equipment. Maybe for strength exercise, it would be nice to have some handheld weights and some stretch bands, but those are not expensive, especially the stretch bands are not expensive. And they've just done them by doing them virtually over FaceTime or some sort of video connection. And they've made those programs work. We also have community care. The VA has also done it with community care. For example, I can order and request community care exercise programs, which I've done for many of the patients that I've referred to Whole Health, and they want exercise programs. I've asked for community care where they connect them with a location near where they are, or another location that can connect virtually. So it's very doable.
All right. Thank you. Any other questions for Steve? I have a question in the chat from Ian. You make compelling case for exercise independent of weight. Can you comment more on combining exercise with weight loss drugs?
Yes,
Yeah, very good question.
well, I can tell you, before the recent medicines like Ozempic came out, for many years, I was very much against weight loss drugs. And I would tell patients not to use them. So I think with the new medications that now have shown great success and decreased risk of kidney disease and other improvements, now I think it's very reasonable for them to use these weight loss drugs. And you know, for a while, the VA, if you don't have diabetes, you had to be in a qualified exercise program to get the drugs themselves. So I think it absolutely makes sense for a lot of patients to combine exercise and these, and only the newer weight loss drugs, but not most of the older weight loss drugs that I'm still against.
Thank you. Any last questions for Steve? All right. Well, if not, we're right at 9:30. Thank you all for attending today.